Hi friends, I am Dr. Teena Bannihatti. Today, let us understand what is the meaning of high-risk pregnancies and what all conditions fall into the high-risk pregnancies and how we can care for the high-risk pregnancy throughout our pregnancy care. So first of all, what is high-risk pregnancy? So the pregnancy in which there is risk either to the mother's life or to the baby's life, we call such pregnancies as the high-risk pregnancy. For an instance, if any mother's age is more than 35 years or 35 years at the time she is pregnant, she is a high-risk pregnancy. So if mother has a pre-existing medical conditions like diabetes mellitus or high BP, or if she is a known case of thyroid problem, or if she is having any kidney related problems or heart related problem, that all is called as high risk pregnancy. So if any lady has conceived because of in vitro fertilization, or if the pregnant lady had the history of 2 or more abortions in the past, they all are called as high risk pregnancies. So there are few subset of high risk pregnancies where the risk factors arise after she becomes pregnant, like multiple gestation, that is twins or triplet. That condition will arise after she becomes pregnant. And there is a condition called placenta previa. That means the placenta is located on the mouth of the uterus, which we call it as cervix. Generally, the placenta is located on the top of the uterus because after delivery of the baby, placenta is supposed to separate and come. Suppose if the placenta is located in the lower part of the uterus, we call that as a placenta previa. That is one of the high risk pregnancy. And the high BP can arise in the 7th or the 8th month of the pregnancy, which we call it as preeclampsia. So in case of high BP in the mother may throw a fits, or she may need ICU admission and all those things. So coming to the other conditions like diabetes can arise in the 6th or 7th month of pregnancy, which we call it as gestational diabetes mellitus. So, and a lady can keep on having the abortions at 6th or 7th month in a condition called as cervical incompetence. So, if the lady is pregnant right now and if she had a history of 2 or 3 miscarriages in the past, at 6th or 7th month, she is having cervical incompetence. So, this pregnancy is going to be the high risk pregnancy. Or if any lady has got the water leakage at 8 or 9 months before her expected date of delivery, before 37 weeks of gestation, we call it as premature rupture of membrane. Or if any pregnant lady has got fibroids in her uterus, so these all fall into the high risk pregnancy. So now, after understanding all these high-risk pregnancy factors, let us understand whether you have to worry or is there any treatment for this or how all these things can be prevented. See, if you are falling into the high-risk pregnancy category, more than routine visits to the doctors may be required. Normally, in pregnancy, for the first 7 months, you have to meet your doctor once in 4 weeks. And after like 28 weeks to 36 weeks of gestation, once every 14 days, you have to go and meet your doctor. After 36 weeks, every weekly visits will be there to the doctor. If you're falling to the high risk pregnancy category, we cannot generalize these rules. Maybe more frequent visits to the doctor may be required. Like as per your condition, your doctor may call every week or every 15 days right from the beginning of pregnancy. And normally in low risk pregnancies, we may require 4 to 5 scans throughout the pregnancy. Whereas if you're falling into the high risk pregnancy, more frequent ultrasound scannings may be required. Like every 3 to 4 weeks, ultrasound scans may be required. And if you are already a known case of like cardiac problem or the kidney related issues or diabetes, then you may require a specialist consultation apart from your delivery doctor, like kidney specialist, heart specialist, or to an endocrinologist. See, nothing to be worried. Nowadays, medical science has progressed a lot and we do have very good for all the high risk pregnant mothers. For an instance, if any pregnant lady is having diabetes, so we can ask you to monitor your sugars every day, either twice or 4 times depending upon your sugar levels. Like we call it as 1 fasting sample and 3 times after your food intake, like 1 hour followed by your food intake. So looking at the sugar values, we may adjust either the tablet if required, or we can manage your sugars using either diet and the exercise alone. So if we monitor the sugars throughout the pregnancy, we can give the good outcome to the mother and to the baby in terms of healthy baby and the healthy mother. So as the mother and baby are healthy, the chance of normal delivery increases exponentially. So now coming to the high BP. So if any mother gets the high BP during the course of pregnancy, we call this as preeclampsia. So how it can be prevented or treated? See, nowadays in the 3rd month scan, which we call it as NT scan only, we can predict, depending upon the Doppler flow or the blood flow to the baby, whether this pregnant lady can become high BP patient at the 9th month or not. So if we happen to see any such things, we can start one small preventive medication called as ecosprin. So it is going to enhance the blood flow to your baby so that the chances of mother becoming high BP patient can be prevented. Hence, all the complications which are related to the high BP can be prevented also. So if our mother is healthy and if the growth of the baby is good, obviously it's going to increase the chance of normal delivery. See, the other factor we will take, like cervical incompetence. Like if any lady has repeated again and again abortions at 6th or 7th month, we call that condition as cervical incompetence. In such circumstances, right now, if the lady is pregnant, we are going to put a stitch to your cervix after 3rd month NT scan and double marker. By putting a stitch to the cervix, we are strengthening the cervix, and we will be preventing 6th month, 7th month abortions, and we are going to increase the chance of term delivery after 37 weeks of gestation. Hence, we are going to get the outcome as a healthy baby and the healthy mother. See, overall, how we can prevent and treat the high-risk pregnancy. See, you should be healthy and fit even before planning your pregnancy. And you can take one preconceptional checkup with your doctor. They may run simple tests like if there is any high BP, sugar, we can find it out. If there are any fibroids in your uterus, all those things can be found. And if any lady has thyroid related, heart related, kidney problem, already the patients themselves will be knowing. And all those conditions has to be brought into control. And then only we are supposed to plan for the pregnancy. And your doctor may advise few pre-pregnancy vitamins like folic acid. So you should be healthy and fit before planning the pregnancy. If there are any pre-existing condition, we can bring them into control or we can cure them. And even after conception, please meet your doctor periodically and follow their advice. And if anybody is abusing the substances, like if anybody is smoking or alcohol consumption, all those things needs to be avoided. So stay fit and healthy before conception and during the journey of pregnancy. That will lead to the good outcome as a safe delivery and a healthy baby and a healthy mother. Thank you.